Good morning, everyone. I am here for my second blood draw and ultrasound. I'm actually at a different office today. I'm not at Baptist South Hospital. It is the butt crack of dawn. My appointment's at 7, so it's like 6:55 right now. So I'm about to go in and I'll check in with you all after the appointment. All right, y'all. I am in my room. I just got my blood drawn. They are going to be drawing for to test my estrogen and progesterone levels. I'm going to get a little more information from the doctor when he or she comes in. But yeah, I'm here waiting. I've kind of got a routine for these appointments. I just wear something comfortable and no underwear, because I'm going to have to take them off anyway. So, no underwear. All right, I'll be back once the appointment is over. Okay, guys. So we are all done. Things are going really, really well. The doctor says that I have a whole bunch of follicles, y'all. They were like just counting away. Counting away in the doctor's office. But yes, so I have a bunch of follicles. What my doctor said, hold on, let me grab my coffee. So what my doctor said was that, I have a bunch, so, which is to be expected because I have PCOS. So he was like, oh, I guess you got a whole bunch of follicles, and they're all in different, sorry y'all. They're all in different stages, of course, as they grow or whatever. And so he said, we see them all, but we don't count them all. The bigger ones are the ones that they count, the ones that are largest diameter. Those are the ones that they count. And I believe they were calling out some numbers. I should have asked that, but I wasn't thinking. Let me tell you about my doctors. Oh my gosh, they harass me. About my FSU purse. They harassed me about my FSU purse, y'all. Like, I'm spread eagle on the table, and they are harassing me about my purse. 2 doctors were in the room. I think one of them is new. A woman, I met her at my first appointment, and I don't remember her name, but the male doctor, Dr. Waldman, he was the one that clowned me about my purse the first time I met him, which was, I think, at my second appointment. Nonetheless, both of them were in the room, and they were kind of, I think the female doctor, she's new, so Dr. Waldman was kind of like coaching her or whatever, and they were talking back and forth to each other and calling out numbers. I think the numbers, like I said, I should have asked, but I think the numbers are the diameter of the follicles. So they were looking at different follicles, and they were calling like, 10, 11, 12, things like that. I think that is the diameter. I want to say for retrieval, what did Tiffany tell me? My nurse Tiffany told me they wanted to be, I think she said between 16 and 22 size in diameter, 16 to 22. I think it's centimeters, millimeters. I don't know. Anyway, I think it is millimeters. Yeah, they want it to be between 16 and 22. I'm just gonna say the numbers, bump the actual metrics or whatever. Just 16 to 22. I'm at, like, I guess 9, 10, 11, 12 ish. And on my, I believe on my left side, there are more there than on my right side. He showed me on the paper where the I guess a medical assistant that was also in the room. There's 3 people in the room, yeah. She was writing down the numbers as they were calling them out. And so I could see on the paper there was an R, there was an L for right, left, and then there were some numbers. Now, I really, honestly, I can't remember which one was which, but each ovary had between like 6 to 8 numbers. So he was like, yeah, you got a lot. It's going well. I have to come back here on Saturday. He said they grow about 2 diameter or 2 millimeters or whatever a day. So by Thursday, today is Thursday. By Saturday, I should have some follicles that are like where they need to be, especially if the ones that are in the 10 to 12, 11 range, and it's 2 per day. So yeah, 16 on up. So we are on schedule. We're on target. Everything looks great. It is all good. They're going to check my estrogen and progesterone level. I started Orlissa last night, and I'll have to get back with y'all on what that medication does, but I feel like it has something to do with my endometrial lining. Matter of fact, let me get back with y'all. Okay, y'all, I'm back. So it is safe to say I don't know what the hell it does. I was looking online. The pharmacy when they sent me the medication, they sent me these sheets. You know how when you get a prescription, they send you a sheet that shares, what the medication is and side effects and all that. So I'm gonna look at that. Look at Dr. Brown. Dr. Brown just rolled up. Which I go to Brown Fertility Clinic. So anyway, I just happened to see Dr. Brown roll up. But I probably need to look at that. I know I looked at it before, and I looked it up, which is why I was able to say I know it has something to do with your endometriosis. Your endometrial lining. But I'm still not connecting how it's helping in this fertility cycle. So I'll just need to do some more. What I'm going to do is I'm just going to email my nurse. I'm just going to email. Listen, that's the one thing I was telling my acupuncturist, that, I'm not stressing, but I find myself consumed and sometimes overly consumed with gathering information about my process versus asking the experts. I'm in the room with them. I have access to them. Just ask the experts. And I think it's because sometimes with these appointments, it's just like, I know there is a sense of, okay, let's just get this over with. Or there is a sense of, I hope things are going well. And that just overshadows any questions that I may have about a pill that I'm taking. I just know I need to take it. But there is that part of me that is very inquisitive and needs to know and needs to fully understand how I'm engaging in this process. So I just need to send that email. I'm sending the email to my nurse and just ask her. But what I did see as I was searching is that the medication is used to help with endometriosis pain, and it lowers your estrogen. So I just need to understand, okay, how is lowering my estrogen helping in this whole process? Which brings me to something else. I just wish that as a teenager, as a young woman, I had a firmer understanding of how my body works and how my hormones work. Not just, okay, stay away from the boys, don't have sex until you're married, and every time you have a cycle, here's a tampon and a pad. Like, I wish there was more education past the sex talk in school in 5th grade and the optional health class. I think health was optional in high school. Well, it may not have been, but it was the class who really paid attention to it, and it didn't really focus on, like, not that I remember, it didn't really focus on hormones and how they interact with, each other and how it causes ovulation. And I don't remember that. Maybe y'all had it. I don't know. You could put your comments. Let me know what your experience was. Put it in the comment section. But I just don't remember having a firm understanding of all the inner workings, the intricacies of my hormones and how my cycle operates. I just didn't. I believe that had I known that, I would have learned about my PCOS much, much, much earlier in life. Because even as I reflect, after I was diagnosed and I had a firm understanding of what the symptoms are of PCOS, I reflected back to when I was in college, like my freshman year in college. And I remember my dad came to visit, I believe it was my freshman or my sophomore year in college. Anyway, I can't remember, but he came. I remember. And I remember him saying, you have a 5 o'clock shadow. And I was like, what is a 5 o'clock shadow? And a 5 o'clock shadow is like, I guess, a beard or something, like hair in this area. And I didn't know that. I didn't recognize that. I remember in college, I clearly remember having cycles that were like 40 days long. That's not normal. That's not normal at all. And as I got older, as I exercised and things of that nature, my cycles became more between 28 to 32 days. But yes, in my 20s, my cycles were like 40 days long. Like, and I didn't know that was not normal, because that was my norm. So anyway, I know I'm going on a tangent, but yeah, I'm just grateful for where I am right now. I'm going to be more present, and I'm going to ask more questions in my appointments. So just to wrap things up, everything is good. We are on track. I have acupuncture tomorrow, and I also have another float session scheduled. So boop, boop, boop. I'm excited about that. Get some relaxation. Just, connect with myself, love on myself, love my body. And then Saturday, I will be back here at this clinic doing another blood draw and ultrasound. Next week is retrieval week. I do not have a date as of yet, but I am hoping and praying that it is like Monday's a holiday, but hey, I hope they open. But I hope it's Monday, Tuesday, Wednesday, or Thursday. Friday, I was booked for a speaking engagement, and I do not want to miss that. And next Saturday is my cousin's wedding, and I definitely don't want to miss that. So, y'all, fingers crossed. Y'all send positive vibes and love. Pray for me, and pray that this retrieval is next Thursday. I'm just going to cement that in my mind. I'm going to cement that in my body. I'm going to cement that in this whole process, that retrieval will be next Thursday. All right, y'all. Let me get on. Let me skedaddle. I have a 9 o'clock and it is like 7:45. So yeah, all right. I will see you all later. Be sure to like this video, subscribe to my channel, and hit the notification button so that you can get all of the updates when I upload new content. I love you guys. Thank you so much for being along with me. Take care.